Hello.
Hi, Catherine.
How are you?
Great. Thank you. Great to see you.
Good. It's so good to see you too. We have Dr. Maitri Sinha here today. She is here to talk about Youth Rise and Cities Rise and the work that you are doing around the world in global mental health and creating mental health friendly cities, which is really, really very important right now, more than ever. And so I'm really excited to have you here. And it's been a while since we've caught up, so I'll get all the updates on the work you're doing. And I will hand it over to you. Thank you again for being here.
Thank you so much, Catherine. And it's always a pleasure to see you. And thank you again for all of your support and leadership in this work. Hi, everybody. I'm Maitri. I'm the CEO and co-founder of Cities Rise, and really honored to be here to say some of the work that we are doing as part of the Cities Rise platform. As Catherine mentioned, it's a global platform for local collective action that was initiated 3 years back as part of a effort to see how we can create a paradigm shift in mental health and well-being, specifically with the emphasis on young people and their own leadership and their insights as part of the transformation process. So what I'm going to be doing is that in order to kind of tell you a little bit about the story of Cities Rise, as well as share a little bit of some of the glimpses of the work on the ground, I'll be using a few slides, so I hope this works. Let's try this. So I hope this is working. Okay. So as I shared, Cities Rise is a platform that was brought together by a number of different practitioners, young people, researchers, policymakers from multiple different countries coming together to see that how can we really anchor ourselves in practical action on the ground? How is it possible to create a shared journey across different cultures, contexts, but towards some kind of shared aspirations? And essentially the vision that was created with a number of these different organizations coming together was a world in which cities would enable young people to grow up, develop resilience, and lead productive lives through mainstreaming mental health across sectors. And our ambitious goal is to reach 1 billion young people by 2030, to see that how we can turn the tide on things like depression, addiction, and suicide by bringing evidence-based interventions, but very importantly, marrying that with communities' own experience. So why the focus on young people and the emphasis on life journeys? So as we traveled across the world and we listened and learned from communities everywhere, I think the one thing that we really got committed to was essentially ensuring the integration of the human being and our connection with things around us. So this three-dimensional journey that we have showing here, which is the person's own inner journey, the journey in the social environment, as well as the broader environmental dimension, that how do we look at how to unlock the transformation within people, but how do you also change the systems that impact their mental health and well-being? So essentially, we are looking at that life course perspective and seeing that what are those 3 key phases of life, from the nurturing phase to the adolescent phase, to where meaningful relationships become important, to that early adulthood and the meaning and purpose of life. And really understanding that mental health is simultaneously impacted by all these different domains. And it's really important for us to take an integrated lens, which brings the social, economic, and the spiritual development of people and society. So from that, I think we were extremely privileged to work with some of the best research experts globally. And across that, we essentially created what we called a global framework for implementation. And the idea here is that the context of work in young people and communities, say in India, is very different from, say, Kenya, different from the United States. But it allows us to really anchor in the local context, but it also gives a shared framework so that we can learn faster from each other, we can help each other, and we can also have a sense of a shared journey around some universal targets, while there might be local indicators and local priorities that are determined by the communities and young people in each city. So essentially the structure and the framework, and I think what is turning out to be a really adaptive element of this work, is this ability to create this hyper-local, contextualized local framework. And the reason we chose cities and communities in the end, because mental health and well-being is so much centered around neighborhoods and where people live. So how do you create that local focus, but also how do you create a global network? And so here we are showing the first 5 cities that we've been partnering with. This includes Nairobi, Bogota, Seattle, Chennai, and Sacramento. So it's spanning across 4 countries, very diverse in different contexts. And so it's allowing us to look at what is uniquely local versus what is very shared. From this, over the last 3-4 years, what we've been really looking at is that how do we start creating what Catherine mentioned, the notion of a mental health friendly city? And essentially, we've been doing it through 2 very important principles. One is that we believe that, when you live in this rapidly changing world and you're really trying to understand that how do you meaningfully support a young person's life journey, that a lot of the inspiration, energy, creativity, a lot of these are within young people themselves. So not just as being, participants, but them being active drivers of change. So how do you come behind and how do you find these young people? How do you build their capacity? How do you connect them with systems? That is a core principle of all our work. The second important piece is that we really need collaborations, and it's important to change systems while we are activating young people. So how do you bring these non-traditional actors to work together? Young people and research experts, young people and professionals, young people and policymakers. So this is showing a little bit of a glimpse of our work in a few different cities, Nairobi, Chennai, different workshops. And then you can see at the bottom, with the pandemic, we had to rapidly move towards the online format. But in some ways, the pandemic was a real time to test, to see that, is this approach really something that is going to be able to adapt when there are things that are going to be changing? And one of the things that we were very fortunate is that about a year back, pretty much early on in the pandemic, we launched a command center out of one of our cities, and essentially every day all 5 cities would be coming together. And this led to an amazing collaboration where everybody started innovating around the pandemic in their own local contexts. So if you were working in schools or if you're working in colleges, how do you essentially pivot around the moment and the fact that some of these places where young people was no longer functional? How do you innovate around that moment? And how is it possible that maybe Nairobi comes up with an idea, Sacramento learns from it, or vice versa? So it was really inspirational to see that around that moment of crisis, both the ability, because this work was so much grounded locally, the ability to rapidly innovate and adapt, but because of that kind of a global network, the ability to also learn and support each other. And essentially the ideas here is that how do you anchor in the human being, but how do you create cities as social innovation labs? And what we have now developed over the last few years is a process of discovery, mobilization, designing, and implementation, and starting to create this notion of a playbook so that different cities or communities can activate their own selves but there is a process and certain principles so that one can be part of this bigger journey. So shifting a little bit towards the pandemic. So one of the things that early on in the pandemic, we decided that we really needed to hear from young people on the ground that how they are feeling about the pandemic, and this was a rapid uh, research that was carried out in collaboration with young people and research experts to see that what are the things that we are hearing from our own first 5 cities, how young people are feeling. And this is just a word cloud to kind of convey that what was starting to surface. From there, we were rapidly able to, and I'm just showing a couple of cities here as an example, that how can we look at that data and how do we understand that what is really critical for us to also transform into action that might have either actual practice or policy implications. So for here example, I'm showing some of the data here from one of our cities, but what we were able to start looking at is that what young people are really seeking. And a lot of this started showing us that things like managing uncertainty, how to reduce stress, how do they combat with loneliness, young people wanting more of peer support. And it was really an inspirational moment where we were able to take some simple results like this. And in the city of Sacramento, for example, it was the first time that policymakers and young leaders came together and these survey results were presented. And that actually led, amidst the midst of budget cuts, for actual funding to be allocated to mental health. Similarly, in Nairobi, you're using some of this type of real-time data, there was much stronger collaboration between youth leaders and the city, county, national mental health to see that are there certain priorities that get supported during this pandemic. So I think what has been really important is that while we continue to drive the larger, shifts within programs and practice, that there is also the opportunity during these moments of crisis to see that some of the changes that sometimes take decades can actually be done really fast because of the momentum. So I'm going to shift quickly to uh, a couple of things now. Is that just sharing that the power of partnerships here. And I want to acknowledge that this work would not have been possible without more than, I think, 30 institutions that came together. And we are extremely uh, thankful and grateful for the ongoing partnership with a number of different groups, and most importantly, the support and the local leadership from each of these cities and communities. And I would like to shift a little bit towards a little bit more of a reflection that there's a lot of work that is happening in this field right now, and I think it feels like there is finally a tremendous recognition that mental health and well-being is such a critical area. And although it's something which is as old as humanity, is as a field is relatively new. And what I find very important, that I think we've been fortunate to be part of this paradigm shift, is to think about that how can we really shift this whole focus on mental health and well-being from always being seen as a big burden to humanity's greatest asset. So how do we turn the tide on mental health and really understand that beyond addressing issues of mental illness, that there is the tremendous need and the potential to unlock you know human beings own uh, assets and resilience. So with that, I'm going to share just a short video to share the little bit of a glimpse in Cities Rise. And thank you, Catherine, and everybody again for the opportunity to share a little bit about our work. I am not sure if this is playing.
Hi, Matri. It's not sharing. Should I share
Yeah.
the link to you?
Yes,
Okay.
please. Thank you so much.
Well, hello. That was a beautiful video with no sound.
Yeah, and it looks like my slides didn't project either. So sorry about the technology glitches.
I know, that's okay, but you know, it was an incredible talk, and you're doing such important work, especially engaging different cultures and different communities and all of in the collaboration on mental health, which we so often don't. It's so often just US or state focused or city focused. So I love that you bring in diverse cities from all around the world. Is there a way for us to get a copy of your slides that we can use?
Absolutely.
Wonderful. So we'll have those, and we will also share your video on social media. So I think we have the link to that. Now, I'm not sure, you never know how things go when you're live. So our apologies for that. But it was really wonderful to see you and great to have you here and sharing all of the wonderful work that you're doing, around the world. And like you said, it's our humanity. It's as old as we are. So mental health is so important.
Well, thank you so much, Catherine. And sorry again about the slides and all that, but thank you again.
Absolutely.
And thank you for all you do.
Thank you.